Good morning. My name is Vishal. Today, I'll be presenting a reflection on my experience performing ultrasound guided venipuncture after completing the difficult intravenous access workshop. I will be using Gibbs reflective cycle to reflect on this experience and discuss what I learned from the procedure and how I will improve my practice in the future. I recently completed the difficult intravenous access workshop, which provided training on ultrasound-guided venipuncture. This reflection is based on clinical experience where I performed ultrasound-guided venipuncture on a patient with difficult venous access. The purpose of this reflection is to analyze my experience, identify what went well, what could be improved, and how this experience will improve my future clinical practice. I had a female patient who required blood collection. Her veins were very difficult to palpate and not visible. She had a significant history of self-harm, which had compromised her veins, making conventional venipuncture very difficult. Because of this, ultrasound-guided venipuncture was used to locate a suitable vein and collect blood. I prepared the equipment, positioned the patient, used the ultrasound to locate the vein, and successfully collected blood on the first attempt. At the beginning of the procedure, I felt a lot of pressure because the patient had difficult venous access and I wanted to perform the procedure successfully. It was one of my early experiences performing ultrasound guided venipuncture, so I was not very confident and was worried about missing the vein. I was overthinking and putting pressure on myself by thinking that I could not miss the vein. However, after the venipuncture was successful, I felt relieved and more confident in my ability to perform ultrasound guided venipuncture. There were both positive and challenging aspects of this experience. One of the main challenges was the patient already had difficult veins and a history of anxiety due to multiple previous needle attempts. The main technical difficulty I experienced was maintaining probe control and keeping the ultrasound image stable. I also forgot to align the ultrasound monitor directly behind the patient, which made it harder to focus and coordinate my movements. However, there were also many positive aspects. The patient tolerated the procedure well, there were no complications, and sufficient blood samples were obtained. I also did not rush the procedure when I encountered difficulty, which helped prevent failed attempts. After reflecting on this experience, I realized that correct positioning of the ultrasound probe and machine is very important for successful ultrasound guided venipuncture. The ultrasound machine should be positioned directly in front of the operator to improve hand-eye coordination. I also realized that the angle of needle insertion is very important when using ultrasound guidance, and continuous visualization of the needle tip is essential. I also realized that I was putting unnecessary pressure on myself by overthinking instead of trusting my training skills. From this experience, I learned the importance of proper positioning, probe control, and needle angle during ultrasound guidance venipuncture. I also learned that confidence and staying calm during the procedure is very important. This procedure was successful on the first attempt, and the patient was grateful because it avoided multiple needle attempts and prevented re-traumatizing the patient. This experience helped me identify my strengths and areas for improvement. If a similar situation arises again, I will reassure the patient before the procedure and explain that ultrasound guidance improves success rates. I will prepare all equipment beforehand and ensure that the ultrasound machine is positioned correctly in front of me. I will focus on probe stability, maintaining the correct needle angle, and continuously visualizing the needle tip during insertion. I will also try not to overthink and instead trust my training and continue practicing ultrasound guided venipuncture to improve my confidence and skills. In summary, this reflection helped me identify what went well, what could be improved, and how I can improve my future practice. Ultrasound guided venipuncture is a very useful skill for patients with difficult venous access, and this experience increased my confidence and understanding of the procedure. Reflection is important for professional development and helps improve clinical skills and patient care. Thank you.